Hi, hello, good afternoon, everyone. So today we are going to discuss about some prescribing guidelines for pediatric patients, geriatric patients, and pregnancy patients and breastfeeding patients. So there are some guidelines. The first guidelines for pediatric patients, prescribing guidelines for pediatric patients. So you can see who are called as pediatric patients, mainly the neonates with a birth to 28 days of life, they are called as pediatric patients, and also infants of 1 month to 12 months are called as pediatric patients, and toddlers of 1 year to 3 years are called as pediatric patients, and preschool children from 3 years to 5 years are called as pediatric patients, and school age children of 6 years to 12 years are called as pediatric patients, and totally below 18 years patients are called as pediatric patients. So here what we have to do for pediatric patients. What are the prescribing guidelines for pediatric patients? The first thing is dose calculations. We have to calculate the dose based on their body weight and body surface area so that we can get accurate doses. And we have to avoid adult doses. For example, if cough syrup, the adult dose is 10 ml, then we have to adjust it according to body weight and body surface area of the patient. And formulation, we have to prefer only liquid formulations like syrups and drops for easy administration. Why? Because the pediatric patients cannot take tablets or capsules or any other dosage forms as easily as liquid formulations. And we have to ensure that the patient should be palatable. Palatable in the sense nothing but palatability means nothing but how a medicine tastes, how a medicine smells. So as adults, we can take any type of medicine. Either it may taste bad or bitter, but the children, the pediatric patients cannot take such type of medicine. So they have to get good taste and good smell out of that medicine. And developmental considerations, as we all know, the pediatric patients' organ maturity is very low. They will be having immature liver and kidney where the metabolism and excretion will take place. So that is why we should be cautious while selecting drugs for pediatric patients. Mainly, we have to avoid drugs like corticosteroids and tetracyclines. Next, regarding safety, we have to avoid drugs like aspirin, which causes Ray's syndrome in pediatric patients. And when you have given some drugs to the pediatric patients, some medicine to the pediatric patients, you have to monitor them very closely for the adverse drug reactions. If any adverse drug reactions are detected, then immediately you have to counter those adverse drug reaction in the pediatric patients. And another duty is we have to educate the caregivers, like their parents, on dosage schedule and administration technique and storage of the medicine. And we have to give some new clear instructions to the caregivers for avoiding dosing errors. So this is about guidelines for pediatric patients, prescribing guidelines for pediatric patients. And next, when we go to prescribing guidelines for geriatric patients are exactly opposite to the pediatric patients. So geriatric patients are nothing but these are older adults who crossed adult stage and who are in older stage. They will be having multiple comorbidities. Multiple comorbidities means nothing but they have faced many diseases and their body is suffering with the 2 or 3 types of any other diseases, and they will be having altered pharmacokinetics. They don't have natural adult pharmacokinetics. The pharmacokinetics of older patients are altered, changed, and they are having increased sensitivity towards the drugs. Why? Because they have been using the drugs for many years. So what we have to do in these geriatric patients? First is we have to start with a low dosage and we have to administer the dose slowly in the geriatric patients. And we have to avoid polypharmacy. Polypharmacy is nothing but poly means many, pharmacy means medicine. We should not give many number of medications to the geriatric patients. so that they will cause drug interactions and side effects. We have to use tools like Beard's criteria. So what is Beard's criteria? Beard's criteria is a tool which is developed by the American Geriatric Society for protecting these geriatric patients. The main purpose is to improve the safety of the older adults and to reduce the risk of adverse drug reactions and drug interactions. So this is the reason why this Beard's criteria is developed by American Society. And monitoring renal and hepatic function. So whenever you are administering drugs to the geriatric patients, you have to monitor closely regarding kidney and liver function. And next, the increased ADR risk is more in geriatric patients. So it may cause confusion, falls, or hypotension in the geriatric patients. So that is why close monitoring is necessary. And for geriatric patients, we have to simplify the dosage regimen. Mostly we have to give only daily once regimen, once daily dosing to the geriatric patients. And also we have to use fixed dosing combinations and also pills for easy administration. And the next one is guidelines for pregnancy patients. So guidelines for pregnancy patients, mainly for the pregnancy patients, we have to avoid the teratogenic drugs in the first trimester. In the first 3 months, we have to avoid drugs like warfarin, isotretinoin, and ACE inhibitors. And the mainly we have to prefer drugs like which are approved by Food and Drug Administration in the category A or B. Such type of drugs can only administer to the pregnancy patients. And the drug should have low effective dose and it should have shortest duration. And next, guidelines for breastfeeding patients. So for the breastfeeding patients, mostly we have to choose drugs which are excreted through breast milk. Such type of drugs are selected for administering into breastfeeding patients. And we should administer the medications mainly after breastfeeding. Why? After breastfeeding, infant will be in rest and then the medicine will show its action. If we administer drugs before breastfeeding, there is a chance that the infant may get those drugs through her breast. So that is the main reason why we have to give medication after breastfeeding. And we have to monitor infants whether they are in sedation or in irritability or any feeding difficulties are there because of the medication which we are giving to mother. So those are the important prescribing guidelines for pediatric, geriatric pregnancy patients and also for the breastfeeding patients. So thank you. Thank you for listening. Jai Hind.